Hip injuries can affect gamut from babies all the way to elderly people. The majority of patients that I see in my practice tend to be young athletic adult patients or adolescent patients. I'm not sure young people are suffering more from injuries now than they were, say, 50 or 100 years ago. I think though a lot of the reason we're seeing more hip problems in young people are because we're recognizing what we didn't recognize in the past. There probably is more younger patients engaging in sports earlier at a more competitive level. And if they have a problem with their hip or do overuse of the hip where they damage a growing part of the hip as they're developing, they potentially can end up with a hip deformity called hip impingement, or the medical word is femoral acetabular impingement. FAI is a condition where there's a deformity on either the socket or the ball side of the ball and socket joint. And if you have a socket that is too deep, then that can block motion. Or if you have a round head that's not perfectly round and has a flat spot or a bump, that can block motion. If you have a combination, which is the most common form of impingement, then you can get severely blocked motion. And the problem we're seeing is blocked motion is one thing, but there's a structure called the labrum that sits right at the edge of the socket, and it gets pinched in between. So these athletes, usually athletic patients that put their hips through large ranges of motion repetitively on a regular basis, they can tear the labrum. And the labrum has pain fibers just like a meniscus does, so they get pain. Now things have changed significantly because we can use the arthroscope, or a pencil-shaped camera, to go deep within the joint tissue. We can look at the joint from inside. We can diagnose the problem, see the labral tear, we can see the deformities of impingement, and more importantly, we can repair the tear, which is felt to not only decrease pain, but to prevent early arthritis when it's not repaired. The procedure is very minimally invasive. It's outpatient procedure. It takes about 90 minutes from the time we make our first of 2 little quarter-inch incisions. Minimal blood loss. Patient wakes up, they're in recovery room. They can weight bear as tolerated on the operative leg with 2 crutches. They go home within about 2 hours, and they're on the exercise bike the day after surgery. The problem is that if they don't recognize it's a problem, or they go to a provider that doesn't recognize that it is a potential hip problem, they can progress to an arthritic state where they lose the cartilage in their hip joint, that at this point in time we don't have a reliable, predictable way of restoring. And I think that's the key. It's just educating the patients, educating the community, educating the providers that care for the community, so that we don't miss the opportunity to take care of these athletes and get them back in the game before it's too late, before they need a total hip replacement.